Welcome to Amplify Family Medicine, the official podcast by the Alabama Academy of Family Physicians. In each episode, we dive into the challenges, triumphs, and innovative practices that shape family medicine across our state. Whether you are a medical professional, a student with an interest in family medicine, or simply a health-conscious listener, Amplify Family Medicine promises to provide invaluable insights and inspire action. Let's amplify the impact of family physicians in Alabama together.
Hi, everyone, and welcome. I'm your host for this episode of Amplify Family Medicine, Caitlin Riggins. I'm a student member of the AAFP, and I'll be starting my second year at the Frederick P. Whitting College of Medicine. Today, we're talking to Dr. John Waits and Dr. Cathy Lavender about family medicine with obstetrics. Dr. Lavender is a professor in the Department of Family, Internal, and Rural Medicine and director of the Family Medicine Obstetrics Division at the College of Community Health Sciences. With an extensive experience in family medicine obstetrics and rural healthcare, Dr. Lavender has dedicated her career to patient care, medical education, and advancing access to healthcare in underserved communities. We also have Dr. John Waits. He is a family medicine and obstetrics physician, CEO of Cahaba UAB Medical Care, and the program director and the DIO of the Cahaba UAB Family Medicine Residency, combining significant clinical experience with a strong commitment to improving healthcare access and policy, especially in rural communities. Beyond his clinical practice, he's played a pivotal role in healthcare education and leadership, founding the Cahaba Medical Care Foundation and actively engaging in initiatives aimed at enhancing care in underserved populations for women and children. Thank you all for being here today, and we are so excited to have you. Thank you again. I'm so excited, and I can't wait to get into this podcast for today.
Thank you for having us, Caitlin.
Of course, of course. All right, so I have a few questions for you guys. We can start off with you, Dr. Lavender. Can you explain the role of a family medicine obstetrician and talk about what your weekly schedule looks like?
Okay. The role of a family medicine obstetrician is to provide comprehensive maternity care, including prenatal, intrapartum, and postpartum care within the context of primary care for all types of patients, both men and women, from the cradle to the grave. You know, family physician obstetricians are a pretty diverse group of physicians, and each has his or her own unique relationship with the communities that they serve. My weekly schedule has changed over the years as I went from a small rural practice to a suburban academic practice. And that typical weekly schedule continues to evolve as partners come and go and the calls pull.
Got you. Thank you for telling me a little bit about that. I know a lot of people kind of wonder about family medicine with obstetrics, and a lot of people don't really know what exactly family medicine with obstetrics looks like. So great answer, and I thank you for that. For the next question, this is for the both of you, and Dr. Waits, you can start off if you would like. What initially drew you to family medicine with obstetrics, and was that the plan from the beginning of medical school, or is it something that you just developed over time?
It wasn't the plan from the beginning. I thought that I would do general surgery. My father's a general surgeon, and I thought that's what I wanted to do. And I absolutely fell in love with family medicine on my rural family medicine rotation. I loved the continuity. I loved the Sherlock Holmes aspect of the diagnosis. And of course, I love procedures, and family medicine is uniquely tailored for all three of those things. And during my clinical years at the University of Alabama School of Medicine, I was at a family medicine interest group meeting, and there were two family medicine obstetricians who had helped reopen a labor and delivery in Pickens County and had watched the infant mortality drop just by them being there and helping their hospital open that up. And that hit on all cylinders for me. It was procedural, it was diagnostic, it was continuity and community, and it was a system-based fix that was enduring. And so I really, kind of from that moment, I was like, I've got to be a part of this in medicine.
I love that answer. I think that's what draws a lot of people to family medicine with obstetrics. So thank you. Dr. Lavender, what's your take?
So I didn't think I was going to do family medicine either. As I entered medical school, I really thought I would do anything but family medicine or surgery. And I think that's really because I didn't understand the specialty. And as a surgically trained family medicine obstetrician, that's pretty ironic, right?
I know, right?
I do both. But seriously, my interest in family medicine probably began on my first day of my family medicine clerkship in a rural community. Actually, it was in Centerville. And I was assigned to Dr. Melissa Behringer, and I was to meet Dr. Behringer at 8 a.m. at the hospital's nursing station. And when I checked in with the nurses there, they ushered me to labor and delivery where she was pushing with a patient. And so I walked in just moments before the birth, and I got to witness this perfect vaginal delivery. And then I followed Dr. Behringer around the rest of the day and into her clinic, and we saw patients from 2 weeks old to 96 years old. And as we were wrapping up for the day, she got a call from the emergency department because in addition to being on call for OB and being in a full clinic that day, she was also on call for the emergency department that day. And so EMS was bringing in a patient in cardiopulmonary arrest, and they were actively performing CPR. And so we get to the emergency room right as they arrive in the ambulance. And I watched them code this patient for a few minutes before Dr. Behringer ultimately called the code and pronounced the patient deceased. And so as I was watching her do this, I realized here I've watched everything from birth to death in one day in family medicine. And I think I fell in love with family medicine that day. Loved the aspects that I could see the whole family. I could see generations of family members all together and really get to be a part of their life for multiple generations. So that's how I came to family medicine, I think.
Another great point. I think a lot of people, like I said, love the continuity of care, being able to see everybody, like you said, basically from cradle to grave. So that's amazing. And I think that's something that we as students like to look forward to as well. What's something that can fit what we want, what we look for. Is it continuity of care? Is it surgery? Is it being hands-on? So thank you both for that. Our next question kind of ties into what Dr. Waits was saying about the family medicine obstetricians that helped open back up a labor and delivery unit. Our next question is, in rural Alabama, we suffer from a maternity care crisis. And how do you see yourself and others in the field playing a role in stabilizing or expanding access to maternity care in these underserved areas? Dr. Lavender, we can start with you.
So I think family physician obstetricians play a very key role in improving access to maternity care, reducing disparities, and providing continuity across the lifespan. They are particularly critical, though, in rural and underserved areas where they may be the sole providers of maternity care. See, often family physicians can make a living in smaller communities because they can do so many different things. And often they can provide that care in communities that couldn't support a group of OBGYNs.
Great answer. Thank you. Thank you for telling me that. Dr. Waits, what's your take on this?
Well, I think it couldn't be a more timely question. There's been a lot of churn, not just in our leadership and legislation, but in Alabama specifically, there have been at least 3 labor and deliveries in rural areas that have closed in the last 2 years, and we've even seen that in urban areas. So something has to be done legislatively, and so there's a role for family medicine physicians to advocate with their elected representatives and just giving them a picture of what's going on the ground. But that's only, that's only a part of our life. It's exactly like Dr. Lavender said. We are uniquely suited to be able to function and have a career and have a ministry in underserved areas, particularly rural areas, because that's really what the specialty is about. We're very broad, we're very diverse, and able to do a lot of different things, which is what a community needs, kind of at scale. So I would, the listeners, the ones that are students and thinking about where they want their practice location to be, the residents, it is absolutely still a viable practice to be in a rural area or an underserved area. And there's really never been a moment where we need people to kind of follow through on what your personal statements going into medical school talked all about. And I think another part of your question was, what are we doing to stabilize that? I think there's a role for hospitals, rural health clinics, and FQHCs that family medicine physicians have taken leadership roles. I've seen Cathy do that over her career. We've known each other for about 20 years, and her leadership role at the University of Alabama we've done that at Cahaba, me and my partners, trying to create practices for physicians where there is work-life balance on the one hand, but on the other hand, where we're still working hard, providing access to our patients in affordable ways. And I think it's just going to take our specialty to continue doing what we're doing while we count on our leaders to support us in financial ways and legislative ways.
I agree. Thank you for that. I think that it's great that you brought up the thing about students kind of going back into these communities and doing what we say in our personal statements. I wholeheartedly agree with that because we are the future of medicine. And we have a question later on down the road that talks a little bit about that and asks you all a little bit about that as well. But I love that you touched on that because that is so crucial for us as students to take into account as we plan to go into practice. So thank you for that. Thank you both. So our next question is for you, Dr. Waits, and it's given the cost of malpractice insurance, how do you balance that cost as a physician in Alabama?
To some extent, it's one of those things that's out of our control to some extent. And so part of how I balance it is it's a little bit like taxes or inflation. And I try not to over-index on malpractice. It's a cost that I just have to pay for. And the claims that I've been involved in, I'm grateful that I had the insurance. The other aspect though is I think it's important yet again for family medicine to do two things. One is advocacy, and so to the extent that every person should have their day in court. I believe in the justice system, but we should also be advocating for tort reform, and so that there's not frivolous complaints, and we should be advocating for our patients so that the court system is not the only place that they can see justice, patient safety, and quality initiatives. So that's the other side of that coin. Is we've tried to be very vocal in teaching our residents and us as faculty being involved in the patient safety process and making that to where there's transparency with our patients, so that it, again, repeating myself, but a malpractice case is not the first place a family can get answers for something that happened that nobody wanted to happen. And so I know that's not the exact answer about cost, but the cost is the thing we're least able to move a lever on. So
I understand. Dr. Lavender, would you like to comment on that?
Yeah, I'll just say advocacy on the state and even national level for tort reform to try to decrease those costs or contain those costs as much as we can. Family physicians are actually have a little bit of an advantage when it comes to malpractice, and often they can get malpractice coverage for deliveries at a much lesser cost than what it costs an OBGYN to get that same coverage. And that's because family physicians are sued less often than OBGYNs.
Okay. Thank you. Thank you for telling us a little bit about that. I know a lot of people don't really understand how that works, especially us as students on the student side. We're not really privy to the information of how malpractice insurance works. So a lot of us would love to know more about that. And I think that answered that perfectly. So thank you for that. For our next question is, what's something about practicing in Alabama that you wish more people understood, good or bad? We'll start with you, Dr. Lavender.
Oh, goodness. It's the people and it's the relationships, and the people of Alabama are just a very loving and appreciative group of folks, and I enjoy taking care of my fellow Alabamians. I wish that more people could fall in love with that. There are challenges. There's financial challenges. There's economic challenges. But I will tell you that our state legislature has made working in a rural area very economically feasible for students coming out. There are a lot of loan forgiveness programs. There's some tax incentives at the state level. And I think we as a state have tried to incentivize our physicians staying in Alabama and serving Alabamians.
Perfect. Thank you. What about you, Dr. Waite?
There's not anything that Dr. Lavender said that I disagree with. I agree with that. And I would just add a few things in terms of people, students, residents that are looking at Alabama as a potential practice site. We get a lot of negative press still There's so many communities, city or rural areas, that at the local level, there's just a lot of nice things. I mean, there's so much hospitality. The people are nice. I've grown up here all my life, so call me biased. That's perfectly fine. I think from a socioeconomic standpoint, I think one thing that's easy to miss if you've trained somewhere else in the country, out west, that version of rural is these huge geographic distances. I think our version of rural in the deep South, certainly in Alabama, is still poverty. And that is something that if that is a call on your life, if that is a reason you got into medicine, there's a lot of work to be done. And as Dr. Lavender said, you can make a great career here while still there's just a ton of need.
I definitely agree. Yes, thank you for that. So kind of going on to that, or piggybacking off of that, what's something that you think that medical students today should be paying attention to or advocating for, not just for themselves, but to think as medicine for the future for the next generation?
Was that to me or both of us? Who's going?
Okay.
Yeah. Sorry,
Go
Cathy,
first.
start talking.
That's okay. Go first.
This statement is not meant to be right or left. I mean, I promise if we had another hour of a podcast, we could play a fun debate on making the libertarian right of center case or left of center case. But I think as family medicine, when we're taking our Hippocratic oath in med school and then, making that come to fruition when we get board certified, we've got to advocate for all of our patients to be able to have access to the healthcare system. I'm trying to carefully avoid all the slogans on both sides. All of our patients need access to the healthcare system, preventive care, chronic disease care, cancer care, long-term care. I don't mean it needs to be free. I'm not making an opinion about a government program, but advocacy for all of our patients to have a fair shot at this, frankly, wonderful healthcare system that we have in this country. It needs to be spread around in some way, in some mechanism that we can all, regardless of our political spectrum, agree upon through kind of compromise and collaboration. So I think that's important for medical students to be engaged in that process. If advocacy is your cup of tea, and if not, jump in and find a way to give back as you build your career.
Thank you.
And I'll just kind of piggyback on that. And access means a lot of different things. It doesn't just mean, free healthcare. It also means being able to get to that healthcare or have that healthcare available to you. So having, physicians in communities where patients live. It's having hospitals that are open, that they can get emergency care. It's having EMS access. It's having transportation to these places. So it means a whole lot more than just economic access. It means physical access, availability of the doctor's appointments and things like that.
I agree. It's a very intricate process. So I'm glad that you touched on that. It's way deeper than just surface level or what people see. So thank you both for that answer. For our next question, this is for both of you as well. Have you seen the field of medicine change since you started practicing? And what changes do you hope to see in the next 10 years? Who wants to go first?
Well, I have a dream of having rural hospitals open with labor and delivery units and access for all of our patients to quality, timely medical care. I think the biggest change I've seen in the last 20 years of my career is the closure of hospitals, especially of rural, but also of some urban hospitals, and the closure of labor and delivery units, even in hospitals that have been able to stay open. This has certainly changed the landscape of medicine. It has changed where medical students may choose to go. As the hospitals close, so do employment opportunities for medical students. And I do think that this is a big change from when I was coming out of medical school a couple of decades ago.
Yeah, I would agree with that. I'm tempted to double click on a bunch of other things about the pharmacopoeia keeps increasing, and I can barely keep up with all the names of some of the medicines. But
Yes.
exactly what Dr. Lavender said, it is like the wrong direction for rural hospitals closing and rural labor and deliveries closing, and just access to care and accesses for place to pick up practice. And going the other direction, I will say that over the last certainly 10 years, there have been numerous programs set in place that seem to be working. There's at the University of Alabama, there's the Rural Medical Scholars that Dr. Lavender and other faculty members there have been involved in getting medical students shepherded through the healthcare community and into rural areas. At the Cahaba UAB Family Medicine Residency, we are the recipients of Teaching Health Center graduate medical education dollars, the Rural Residency Program Development grants. That there's at least a dozen rural programs that are creating family doctors with interest in rural areas. And even on the topic of today, family medicine obstetricians. So whereas when Cathy and I were finishing fellowship, you might say, oh man, it used to be that 25% of family doctors delivered babies, and now it's down to, some nothing percentage. There are more FMOB fellowships today than there were just 5 years ago. And the real crisis point is that they need places in rural Alabama and rural other states to practice. So we've got some things working in the healthcare system specifically related to training, but we've got to stabilize the payment structures for hospitals and other FQHCs and rural health clinics so that we can capitalize on this moment of training where we really are putting doctors in rural areas. So yeah, I mean that's a real call to these next few years.
Thank you for that. I think that is important. There are a lot of schools who are doing programs like that. Like at my school, we do have a program that I'm in that's kind of gearing students to be ready to go into the rural areas as
Yeah.
primary care physicians. So that is so important because we are able to see what it's like, go into these clinics in our early years, see what it's like for patients, and be able to take those experiences and help fuel our journey for the future. So I'm glad that you all talked on that, and I feel like that's something that we should be advocating for. Like I was saying earlier, the things that medical students could do, that's something that we can advocate for more as the next generation of medicine for other generations to continue to come through medicine in order to see the change that we want to see and that you all want to see as well. So thank you for that. Well, I don't have any more questions for you all. That was all of my questions that I have. Is there anything else that y'all want to say or touch on today while you're here?
I'll just say, despite some of the problems that we've addressed today, it's a great time to be a family physician. It's a great time to be a family physician obstetrician. We have more opportunities. We have more respect. We, have more things than we did 20 years ago. And it is a great time to be an FMOB.
Yeah, I would agree with that. One of the early questions you were asking about a day in the life, and I was just thinking as Cathy was sharing about, the sleepless nights, the kind of taking too much call, and I would do it again. The students and residents thinking about rural, thinking about obstetrics, wanting to know if they should get involved. It is a great time to be a family physician. And Cathy, you mentioned the respect that family medicine OB has. I just want to add that we've got a board of family medicine obstetrics that is new. I mean, this didn't exist 20 years ago, but there's now the opportunity after you finish your family medicine training and you get board certified with the American Board of Family Medicine. After your year of fellowship, where you get your surgical qualifications, doing C-sections and vacuum deliveries, and you're able to sit for an oral exam after your proctored C-sections, and just this is a great time to consider helping turn the tide of these rural maternity deserts by going into family medicine, doing obstetrics, getting double boarded, and just being involved. Like Dr. Lavender was sharing, from the beginning of life to the end of life, we're uniquely situated for these underserved communities, and can be a great career for you.
I agree. It sounds like an amazing career, especially if you're looking for something that has that continuity of care, like y'all were talking about earlier. And if you want to be involved, as you were just saying, from the beginning to the end and in these patients' lives and being able to follow them, I feel like that's something that's very rewarding and something that I look forward to as a future physician is being able to follow patients, not only from when they give birth, but when their children may give birth in the future, and you're able to do the same. So I feel like it's
Right.
such a beautiful career to go into. And I think that you all chose an amazing field to go into. And I thank you all for talking to me today about your jobs. That is amazing. And I look forward to learning more about family medicine with obstetrics. And I hope that our viewers are able to learn more from where we talked about today. And I thank you all. That's all we have time for today. And like I said again, your time is very much appreciated. If you all would like to join the AAFP, please go to aafp.org and be sure to subscribe to our podcast to get notified when we have a fresh episode of Amplified Family Medicine. Thank you all again and have a great day.